So today I'm going to be going over the movements of a transducer as it pertains to ultrasound and more specifically echocardiography. We've all been on a road trip, let's say, or trying to get somewhere. We turn the wrong way and the GPS says recalculating, turn around. You've went the wrong way. That's what it comes down to. We've turned the wrong way, we're going away from our destination, or we're not getting to our destination as efficiently. That's what we're looking to do with moving the transducer in ultrasound. We're looking to get to the destination most effectively, most quickly, and most accurately. And so, the importance of a transducer movement, we're looking for image clarity. We're looking to find in echo the correct window between the ribs. We're looking to find the right way into these images, into these planes, into these views, and get the most accurate images that we can. Um, and so we're looking to get in the right imaging plane, trying to get our angle of attack, so to speak, into the heart. Let's say if we're trying to come into a certain way, we want it to be appropriate and we need to move the transducer in order to get that. And so the big red one at the bottom here, being on axis, that's the most important one. Being on axis is what makes a sonographer accurate. It's accuracy in imaging is being on axis. And so it's extremely important. So what is on axis? On axis in the article Ultrasound Basics by POCUS, that is point of care for ultrasound, it's a website you guys can check out. They describe it as the plane which you are imaging in. And so, important in cardiac imaging, as being off axis can give you cuts of the heart that can be very misleading. Basically, what that's saying is if you're off axis, if the movements of your transducer have got you in the wrong place, you have misleading information. And so that's very harmful to patients, something that we want to be away from. And so we need to know how to move our transducer to get it on axis, to get accurate imaging, and to overall help people the most that we can. And so that's what we're seeing over here on the side. You can cut the sandwich one way, into triangles, let's say. You can cut it into halves, up and down the center. Both are accurate, you're getting the half. When you have a bot taken out down here, if we go off axis, let's say, and we cut the wrong way through this sandwich, we don't know that a bot's been taken out of it. Okay, and so that's what we're trying to do is get accurate imaging. We need to know how to move our transducer in order to see that bot taken out of the sandwich, in order to know what's going on inside our patient's heart. Okay, and so these are some of the planes that we'll look at from an echo perspective. We have short axis, long axis, and 4-chamber down here. We're going to go with apicals. 4-chamber is just the top of apical. Okay, so these planes cut the heart in a different way to give us an image. And so the types of imaging, as described by the American Institute of Ultrasound Medicine, are sliding, rocking, tilting, rotating, and compressing. And so what does that mean? Well, sliding is just how it seems. We're sliding across the patient's body in order to get an image. And so that's the first thing that anyone does, is they'll slide somewhere across a patient's body in order to find an image. It's the most simple movement that we can make. Now, rocking is a different one. Rocking, we're doing this kind of motion. We're taking the transducer and rocking in a heel to toe, toe to heel fashion across the patient's body in order to get accurate imaging. And so this is super helpful in aligning your image, getting it on axis, and getting the appropriate measurements using your ultrasound machine. Now, tilting, exact opposite of rocking. We're doing it side to side, kind of in a fanning motion, opposed to in a heel to toe motion. And this is something that we're going to see in echo going through the short axis views. So fanning through the heart this way. That's really what we're seeing tilting with in echo. So it's super important to know when to tilt and how to tilt your transducer in order to get an accurate image. Rotating, exactly how it sounds. Instead of, let's say, the notch on our transducer, the clip on this pin, pointing at the right shoulder, we rotate and point at the left shoulder. And so that changes our view. We can go from a parasternal long axis, cutting through the heart this way, into a parasternal short axis, cutting through the heart this way, using rotation. And that's really important to know how to do that in order to get your images as accurately as you can. Now, whenever it gets to compressing is a big one for our vascular friends. In ultrasound, echo uses compression, compressing the muscle, putting pressure, trying to get image clarity. Vascular, as described in the American Family of Physicians website, they use it for acquiring the collapse of vessels, or lack of collapse, or collapse when there should be no collapse of that vessel. They apply compression to the patient's body with the transducer, and that can give them a lot of information about different things such as deep vein thrombosis. So super, super important. If there's anything I could tell you, it's very important to understand how sliding, rocking, tilting, rotating, and compressing all lead to more accurate imaging and more accurate overall scans that you can get as a sonographer. So if you guys have any questions, just leave them in the comments. Thank you so much.